I was dealing with the certificates. So in that certificate, I dealt with the accused, the sexual offence certificate of accused examination and the witness examination. Okay, so the next certificate, which is very important for your exams practical point of view, is the drunkenness certificate. Okay, so today we'll deal with the examination and certification of a case of drunkenness. So why this certification is needed for us people? So what happens is the drunkenness was drunk and come. So there are many medical legal cases are involved in this. So one is drunkenness, drunken drive, second drunken crime, and drunken and cases we come across associated with the drunkenness. So what happens is, like for example, I told you drunken drive. So the driving or any accident thing is there, so that you have to deal with. Apart from that, you will have to deal with the drunkenness also. So you will have to make sure that the person has consumed alcohol and he is under the influence of alcohol. So for that thing, you will need to know the drunkenness examination and the certification. Okay, now to start with, so the drunkenness you should know. So this theory part is not yet dealt for you people. So I am just dealing with the practical point today. So whatever practical aspect is there that I'll be dealing with. Again, for this thing, you will have to remember the proforma. This terms that you need the proforma correctly, and you will have the scheme of examination. Then how to certify this, and what are the laboratory investigations are required. So the first and foremost thing is, very briefly, I'll just tell you about the alcohol. So when you say the drunkenness, he has to consume the alcohol. So this alcohol, it is a CNS depressant, and it is also known as inebriant substance. In the sense, the substance which produces intoxication, you can call it as inebriant substance. So commonly we refer it as ethyl alcohol. When you say he has consumed alcohol, it is nothing but the ethyl alcohol. The physical property of ethyl alcohol is it is a transparent volatile liquid having a characteristic spirituous odor, and it has got a burning taste. So the 90% of ethyl alcohol is oxidized in liver, and 10% is excreted through all routes of excretion. So that is what is the metabolism. Since it is excreted through all the routes, so mainly in the urine and the breath it is excreted. So the rate of disappearance from the blood is the 10 to 50 ml per hour. This is what is, and it is equivalent to 50 milligram %. Lower concentration causes the depression of more specialized and sensitive cells of the cerebral cortex. So there will be a loss of or the depressed action of the conduct, judgment and self-criticism. Increasing concentration, it depresses the brain functions. It will also lead to the depression of the vital centers. Now coming to the absorption, So the 20% is absorbed from the stomach, 80% is absorbed from the small intestine, and it is detected in the blood within 2 to 3 minutes of consumption. Is reached within 45 to 90 minutes after the consumption. Okay, next coming to these are the, briefly I just told you about the physical properties and the metabolism. Now coming to the symptoms. So these symptoms is very important for us to study. The symptoms you can categorize into the stages. So the first stage is stage of excitement,
Excuse
then
me, ma'am.
stage of incoordination, stage of coma.
Excuse me, ma'am.
Yeah.
Ma'am, the slides are not moving.
Slides.
Are not moving.
Slides are not moving. Let's move. So, here it is moving. Okay. Okay. Here I can change the slides, but maybe some problem is with your system.
It's not moving even for me, ma'am.
Okay.
It's not for anyone, ma'am. We're still in the first slide.
Okay. But ಯಾರಿಗೂ ಮೂವ್ ಆಗ್ತಾ ಇಲ್ಲ ಅಂತಲ್ಲ. Hello, can you hear me, no?
Yes, ma'am, we can hear you, ma'am, but we're still in the first slide. Only the slides are not moving.
Okay. Just wait, I'll see.
Okay.
So only the first slide only is there. Remaining slides you couldn't see.
No, ma'am.
For all of you it is the same?
Yes, ma'am.
Or only
Nobody
one
can see.
person?
No, ma'am.
For
Nobody
all
can
of
see.
you. Sorry, I'm not getting you. Hello?
Ma'am, for everyone,
Ma'am,
ma'am, no one can see.
No one. Okay, fine. I'll just see. But ಇದನ್ನ ಇದು ಮಾಡಿ ನೋಡೋಣ, ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಅವರು ಸ್ಟೂಡೆಂಟ್ಸ್ ಏನು ಮಾತಾಡ್ತಾರೆ ನೋಡು. ಮಾಡಿದ್ದೀರಾ? ಅಲ್ಲ ಅವ್ರ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮ್ಯೂಟ್ ಮಾಡಬೇಡಿ ನೋಡೋಣ ಅಲ್ಲ, ಯಾಕಂದ್ರೆ ಅವ್ರದ್ದು ಸ್ಲೈಡ್ ಹೆಂಗ್ ಗೊತ್ತಾಗ್ತಾ ಇದಾರೆ. ಕೇಳೋದಕ್ಕೆ ನೀವೇ ಮಾಡಕ್ ಹೋಗ್ಬೇಡಿ. ನೋಡೋಣ ಅದೆಲ್ಲ ಕ್ಲಿಯರ್ ಆಯ್ತು ಆಮೇಲೆ ನೋಡೋಣ. Okay, now to start with again, I'm just restarting because you people had a problem in slide changing. So I think that got rectified. Let me check. Okay. Now, since you had a problem, so I'm going to restart this brief and just brief it. Okay. So drunkenness, the scheme of examination, then certification and the lab diagnosis. Now coming to the alcohol, the properties of the alcohol, you can also call this alcohol. It is also known as a CNS depressant. It's also called as an inebriant substance because it produces intoxication. The common what we use is the ethyl alcohol. So when you say alcohol, it refers to the ethyl alcohol. And as I already told you people, the physical property is it is a transparent volatile liquid having a characteristic spirituous odor and a burning taste. So the 90% is oxidized in liver and 10% is excreted through all routes of excretion, mainly in urine and breath. So the rate of disappearance from the blood is at the rate of 10 to 15 ml per hour. So this is equivalent to 15 mg%. I hope all can change the slides now. There is no problem, I feel. Is this okay for you?
Yes, ma'am.
Yes, ma'am. No problem.
Okay, fine. Next, the lower concentration, as already told you people, it causes a depression of more specialized sensitive cells of our cerebral cortex, which would lead to the depression or the hamperedness in the conduct, judgment, and self-criticism. So increasing concentration, it causes the depression of the brain functions and also the depression of vital centers. So as already told, again the absorption is 20% is from the stomach and 80% is from the small intestine. And it is detected in the blood within 2 to 3 minutes of consumption. So the maximum concentration is reached within 45 to 90 minutes of consumption. Now coming to the symptoms. So symptoms are very, very important for us because based on the symptoms, we are going to judge what toxicity or what is the level of the toxicity. So that's why the symptoms are categorized like in the stages, like a stage of excitement. For second stage, it is the stage of incoordination, and the third stage is the stage of coma. Now, what are the circumstances where you come across? this regarding circumstances, before starting only I told you people. So when drunk and drive and drinking and this thing, getting involved in the sexual assault cases, and drinking and making a public, creating a public nonsense. So drunk and driving involved in the criminal offense. So these are the circumstances. So according to British Medical Association, this condition is produced in a person who has taken alcohol in a quantity which is sufficient to lose control of his faculties and unable to execute safely the occupation which was engaged at a particular and So now next, coming to the scheme of examination for the certification of the drunkenness. So how to proceed for the examination? So as I already told you, before certification, we need to examine the patient thoroughly. Okay. Now to with the examination, what are the main objectives for the examination? The first is subject has consumed alcohol or not, that you will have to judge it, or first you will have to rectify whether the person has consumed alcohol or not. If he has consumed it, then whether is he under the influence or not, that you will have to rectify. Second objective is say for him to be detained in the police station, or he should be admitted to a hospital. That again will come. So after judging what extent he has drunk or what is the level of the toxicity. Okay, now coming to the examination proper, remember one thing, consent is very much needed. Okay, when you can take a written consent. Okay, if the person is very well oriented, is conscious, well oriented, and he is sober, so you can take a written informed consent.